In chapter 32, we're going to look at the arteries and veins in our head and neck anatomy. So one thing to note is that when we're looking at something red, the red is referring to an artery. And when we're looking at something blue, the blue is referring to a vein. So let's look at the next slide so that we can have a better idea of what this whole thing means. So I have posted a video on Blackboard that explains what the difference is between an artery and a vein. And really what I want you guys to understand is that an artery, or something that is red, is basically a vessel. So basically, let's say this is your heart, and we all know that blood, is always pumping through our heart, and then the blood goes through many areas of the body and, gives supply and innervates many areas of the body. So what's happening is if the blood is going away from the heart, it's going through the artery. If the blood is coming to the heart, okay, then it's coming to the heart through a vein. So the way you can remember it is artery starts with A, away starts with A. So if there is a blood supply, if there is blood that's going away from the heart, like in this example here, we can see the blood going away. You can see the arrows, they're all going away from the heart. That means it's going through an artery. If the blood is coming towards the heart, and here you see an arrow, showing that the blood is coming towards the heart, then it's a vein. So let's look at arteries first. So when we're looking at arterial supply, what that means is that blood supply in the arteries, that's what we're looking at right now. Here's the heart, and in the heart we have this important thing over here that is called the aorta. It's also where the blood is also, pumped through. There is something called the brachiocephalic artery, or the brachiocephalic trunk, and here's that word right here, and that's this one right here. So the blood rather is being pumped through the heart, and then it is going away from the heart, so it's going over here, and one place it could go is the brachiocephalic trunk or brachiocephalic artery, which branches off or which comes out from the aorta. And then from there, it can either go to the right subclavian artery, which is right here, so the right subclavian artery, which is this one, and it goes towards the right arm, or you can see there's two branches, one towards the arm, the other one goes up towards the head and neck, right? And this is the one that we're most interested in, and this is called the right, because this is on the right side, the common carotid artery, the right common carotid artery. Okay, there's also one on the left. There's also a left common carotid artery for the left side versus the right side. So there's one on both sides. This is the artery we're most interested in because this is the artery that sends all the blood to our head and neck and to our face. So sometimes, when we get embarrassed and our cheeks start to flush red, well, that's because there's a lot of blood in that area. Or sometimes when we see something so gross and we start to get very pale and faint, all the blood is going away from our body, right? So blood supply is always present in our head and neck area, and it's important to know what the arteries are and what they actually do. So let's review again. This on the left side, we have the same thing. We also have a left common carotid artery that goes towards the head and neck, and supplies the area on our head and neck. And we also have, where's my mouse? I kind of lost my mouse. Oh, here we go. And we also have the left subclavian artery, which goes towards the left arm. So the aorta branches off into two sections. One is the common carotid artery so that it can supply this area, and one is the subclavian artery so that it can supply the arm. Now, what we're most interested in is the common carotid artery, because the common carotid artery affects this area over here, which is what we're interested in. It gives blood to the area over here. Now, there's something called an external carotid artery, and there's something called an internal carotid artery. And really, the main difference is that the external carotid artery, so that is this one right here, is closer to the teeth and the mouth. And this is the one, the reason why it's called external is because if I were to take off the facial layer, the layer of the face, you'll see the arteries, like you could visibly see it. It's on the outside. Whereas with the internal carotid artery, internal means it goes deep inside the skull. So it's going into the skull and it's like way inside the skull. So it's like intertwined and it's really inside the skull, whereas the external carotid artery, it's, the reason why it's external is because more is on the superficial layer. It's more like on the outer layer of the face. So if you take out the inner layer of the face, of the outer layer of the face, you'll see it right away. Whereas the internal carotid artery is like further inside the skull, and it branches to many areas of the brain. So again, here is your common carotid artery right here, and we have, you can see that the external carotid artery is more over here because you can see it, right? It's like right against the face. Whereas if you look at the internal artery, which is not shown over here, it's the vein that's shown. But basically, if this was an artery, it would go deep inside the skull. That's why it's internal, because it's really way deep inside the skull. So when we're looking at the carotid artery, the common carotid artery, as we know, there's the external, which is the one that's towards our area of interest, the face and the mouth. And then we have the internal, which kind of goes all the way up into the skull. Now, when we're looking at the external carotid artery, you'll see that there are many different branches. There's the facial artery, there's the lingual artery, there's the superior thyroid artery. And these are basically arteries that give blood to, for example, to the face. And we'll look at more exactly like where it goes in the face. This lingual artery, lingual means tongue, right? So this is an artery that's going towards the tongue. We have a dorsal lingual artery, which is dorsal. If you think of dorsal tongue, it's supplying like the top layer of the tongue more towards the back of the tongue. Then we have the deep lingual artery, which is supplying blood to the front part, the anterior part of the tongue. And we have the sublingual artery. So we're going to look at all of those, but note that the arteries have many different branches, and then within a branch, it also branches off as well. So it's lots of pathways that it can go through.